Welcome to the ATC-HSSC online training series, where you learn essential procedures that ensure safe and effective patient care. In this video, we'll demonstrate the correct technique for administering a subcutaneous injection, including when it's indicated, how to prepare, and how to perform the procedure safely and effectively. What is a subcutaneous injection? A subcutaneous injection involves delivering medication into the fatty tissue layer just beneath the skin, known as the subcutis. It allows for slow, sustained absorption of medications and is commonly used in both clinical and home care settings.
When is it used? Subcutaneous injections may be prescribed in cases such as
Cannot swallow safely due to dysphagia. A subcutaneous injection allows medicine to be given without using the oral route. If the stomach or intestines cannot absorb medicines properly, subcutaneous injections provide an alternative way to deliver the drug effectively. In intestinal obstruction, oral medicines may not pass through the gut normally, so subcutaneous injection is used to ensure the medication is still delivered. When there are painful or severe lesions in the mouth or throat, swallowing tablets can be difficult, so subcutaneous injection becomes a practical option. If a patient is unconscious or too weak to take medicines orally, subcutaneous injection allows safe administration without relying on swallowing. When a medicine needs slow, steady release over time, giving it subcutaneously helps maintain a sustained effect. Common injection sites. For the upper arm, use the back or side of the upper arm where there is enough fatty tissue. For the upper buttocks, choose the area between the waist and the upper gluteal fold.
Choose the site based on comfort, accessibility, and rotation protocols.
Materials required. By preparing a clean tray with all necessary items. Medication chart, prescribed drug in ampoule or vial, sterile syringe and appropriate needle, alcohol swabs, clean gloves, and a kidney tray for disposal. Step-by-step procedure. Begin by verifying the patient's identity and confirming the medication order.
Perform hand hygiene. And put on clean gloves.
Withdraw the prescribed medication using aseptic technique without injecting air into the syringe. Position the patient based on the selected site. Upper arm, relax by the side. Assess the site for swelling, redness, or tenderness. Clean the skin in a circular outward motion using an alcohol swab and let it air dry completely. Remove the needle cap using your non-dominant hand. Follow the 5P technique. Either pinch or stretch the skin depending on the patient's body type. Prick hold the syringe like a dart and insert the needle at a 45 and 90 degree angle, depending on needle length and fat depth. Push the medication. Pause for 10 seconds. Withdraw the needle at the same angle and apply gentle pressure with an alcohol swab. Dispose of the used syringe and needle in a sharps container, never recap. Perform hand hygiene to prevent infection, then document the time, dose, route, and injection site accurately. Observe the patient after the injection for any pain, swelling, dizziness, or allergic reaction, and document the response. Post-procedure care. Dispose of all sharps and biomedical waste in the correct containers according to protocol. Remove your gloves safely and perform hand hygiene to prevent infection. Document the medication given, the dosage, the time, and the injection site in the patient's chart. Observe the patient for any immediate reaction, such as pain, swelling, dizziness, or signs of allergy. Avoid these common mistakes. Incorrect needle angle or site selection. Rubbing the area aggressively after injection, using an inappropriate syringe or needle size, recapping the needle after use. This increases needle stick risk. Key practice points. Always follow the 10 rights of medication administration to ensure the correct patient, drug, dose, route, time, and safe practice. Avoid massaging the injection site, especially after insulin or anticoagulants, because it can increase bruising or change absorption. Rotate injection sites every time to prevent tissue damage, hard lumps, and poor absorption. Monitor the patient for allergic reactions and check the site for redness, swelling, pain, bleeding, or infection. Never recap a used needle. Dispose of it immediately in a sharps container to prevent needle stick injury. Mastering subcutaneous injection ensures the safe and effective delivery of medications like insulin. Regular practice, following updated guidelines, and using proper techniques, such as correct site selection and aseptic precautions, help prevent complications and improve patient safety. For more practical clinical videos and learning content, visit www.healthcareeskilling.com. Thank you.